This video is a brief summary about some of the ethics and guidelines related to clinical documentation, in particular case notes. So the first question in having this presentation is, of course, what is clinical documentation? And clinical documentation basically refers to all of the records that counselors keep about their contact and their work with clients. So this would include a record of appointments, any treatment plans that are developed, assessments, referrals, both to the counselor and from the counselor, homework assignments that the client completed or was assigned and never completed, consultations made from the counselor with another provider about the client's case. So perhaps you maybe consult with the psychiatrist that you have at your facility. Maybe you consult with a supervisor to make sure you're on track. Maybe you consult with a peer who has expertise in a culture or an issue that is relevant to your student or your client. Any paperwork that you may get from the hospital, a hospitalization, either one that you initiate. We talked a little bit about doing involuntary commitment procedures and then also voluntary commitment procedures. So you would end up getting some paperwork back from the hospital, so you would include that into the chart. Phone calls, text messages, emails. If you use text messaging or emails with your clients, then you would want to keep a record that of what you've received and how you responded or did not respond. And then all of these records are, of course, kept confidential. A lot of people think that records are to protect the counselor from getting sued in the event that something happens to the client. And while that is a really big part of what clinical documentation does, it is not the main purpose. The main purpose of recording the work that we're doing is to provide very effective treatment. And when the idea is that if you don't provide clinical documentation, then your treatment will be less effective because there won't be a record of what you've done, what has worked, what hasn't worked. You're going to work with a lot of people, so that's impossible for one person to keep up with all of those records. And people are really serious about the responsibility of counselors to keep records. So if you slack off on your records in your place of employment, whether that be a public school, and there are different standards, you can see the journal article that's posted online to read a little bit more about school counseling record keeping. But or a college counseling center or an agency or even a licensure or certification board that credentials you, if it is discovered that you're not doing proper clinical documentation, that's a really serious violation because it is seen as absolutely pivotal in being able to provide effective treatment is that you keep a good record of it. So in addition to all of the things that I already mentioned about a record of all the contact, you also want to include what you've been doing with the client. So what interventions have you used? What has been the client's response to those interventions? And are they making change towards the treatment goals? Some of the language of how a case note will sound is often that you'll say, for example, the client demonstrated an understanding of relapse triggers by sharing blah, 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 by sharing that going into restaurants makes the client want to relapse and looking at the bar or something. A client was provided with a referral to a support group and felt hopeful that the group would be beneficial. Suggested to client to make contact with teacher. Client indicated not being ready to make this contact at this time. What you don't see here is any language that is judgmental, and it is also very concrete. So you do use your clinical judgment, but it's not judgmental. There are some really specific ethics related to clinical documentation. This first one that comes up in the 2014 American Counseling Association Code of Ethics would be Ethics A1B, Records and Documentation. And this just basically says that you are required to keep records, and you're also required to make sure that no one can get those records. Most of the time, records should be kept in a locked room in a locked container. So it's not enough to have your office door be locked and have all your files on your desk, but you actually need to take your files you would actually need to take your files off of your desk and put them into a locked file cabinet within the locked office room. Now that was much more of a case with with paper files, and not all facilities are using paper charting, but there is oftentimes at least a paper chart that goes along with the electronic record, where most of the progress notes might be kept in an electronic record. Some sites have migrated towards scanning all external hard copy documentation that might be associated with the client and then connecting those scanned documents to the electronic progress notes, but other sites will still maintain a paper chart for some of the external documentation coming in for the client, and then only have the progress notes on the computer. So there's different guidelines about making sure that the records are safeguarded when you talk about technology, and we'll get a little bit more into that later. This last sentence here, if amendments are made to records and documentation, counselors take steps to properly note the amendments according to agency or institutional policies. So if you go into a chart and you realize that you accidentally entered the incorrect date of when the client session really occurred, after you did that note, if you have to go back in and change anything on that note, then you have to document that you have essentially tampered with that note. And so you would just want to say, on April 11th, I worked with client Billy Joe Ray. And then let's say on April 14th, you're looking at that note and you realize, oh, I actually didn't meet on April 11th, I met on April 10th. You would go back into that note from April 11th and say, this note is being corrected to document the proper date, which it was incorrectly entered as April 11. The actual appointment occurred on April 10. You just even want to document when you are changing something within it, because once you've completed a note, that note should be done and it should not be messed with again. But if you do have to mess with that note again, then you would want to note that you have changed it. Okay, this is a really big issue, or this is actually a really big part of the Code of Ethics, and that's Section B. And this relates to creating and maintaining documentation, confidentiality of records and documentation, that you also keep a permission to record or permission to observe form, and you all will use those in your internship. And then the next one, B6E, is about client access. The gist of this is that your clients are allowed to see their records, but it's not considered ideal for them to constantly be asking for the records or to see the records after every session. And so the thought is that the clinical records are a professional dialogue about the progress in treatment. And if a client wants to see those, then the counselor should talk with the client about, well, why do you want to see them? What is it that you hope to get out of them? And then if it is determined that the client is competent and in their right mind, and that it might be helpful for the client to look at the records, then the counselor would sit with the client and go over what they're seeing in the records, rather than just printing out all of the notes and handing them to the client. But that there would actually be an appointment that would be documented, that you say reviewed client's records, but that these times are really going to be minimized, that it's not common practice for clients to look at their records frequently. Okay, this continues on with assistance with the records, and just says that, you know, if you do have a client who requests their records and you determine that if that is appropriate, then you're going to provide assistance and consultation with interpreting those records for the client. Disclosure or transfer, that you unless there's a reason to break confidentiality, that you are never going to share records unless you have written permission from the client. And then you would want to include that written permission into your clinical documentation. Storage and disposal after termination. So this is important because you're not going to keep records on and on and on till the end of time. It becomes a lot easier to keep records for a lengthy period of time when you use electronic record keeping, because you don't have the physical space taken up by lots and lots of client charts. But nevertheless, you still would work with whatever your state laws are and whatever the policies are of the facility where you work to determine, is it 7 years that you should be keeping records? Is it 5? Is it 10? So there's different guidelines, and you would learn those in the setting where you're hired or where you're doing your internship, that you do hang on to client records even long after your clients have stopped working with you. Excuse me. And then the final note here is about reasonable precautions that you, if a client, if the counselor ends practice, that you want to make sure that you have a plan. If something happens to you and you're not able to continue practicing, that there's a plan in place for all of your records to be appropriately taken care of, that you've appointed a custodian of your records who will be able to take over for you when you die or become incapacitated or something. You wouldn't want to be in an accident and not be able to access your charts for 6 months and just say, have your parent come over and gather up all your charts and pass them off to another counselor. You would want to take as much precaution as you could in planning for another professional to take care of that role. So then further into the Code of Ethics, H5 relates to distance counseling and has some specific reference to records within distance counseling relationships and the use of electronic record keeping even in face-to-face sessions. And basically that's letting you know that the file, since it's not going to be in a locked room, in a locked file cabinet, that the computer or is in a locked room, and then the file is actually encrypted or has some other kind of security feature to it. So there should be at least 2 checkpoints. Somebody should not, the computer that has the electronic file system on it should be password protected. And then to get into the application that is the actual software for the record keeping, that should be password protected. And then if there are multiple users, then only if, let's say you're working at a counseling center and there are 5 counselors inputting all into the same software system, well, counselor number 1 should not be able to access counselor number 4's files. So even within the software, there would be additional levels of precaution. Overall, when you're writing, it's really important that you become an effective writer and that you're able to communicate your clinical judgment, your observations about the client, and the client's progress towards the treatment goals in a very professional way. So your language and your case notes, it should be grammatically correct. It should be really clear. You shouldn't rely too heavily on acronyms or technical jargon. It should use the language of the field, but not in a way that makes it less easy to understand. And most of all, the records should always be current and they should be accurate. There have been times when I have heard people who've had to review records for violations that counselors have had, and they go back in and they'll say that some of the the writing that is used in clients' charts has been not what you expect for a professional. But I know that you all will do a good job with writing. You don't have to be a novelist or a journal article writer. You just need to be able to write very clearly and concisely in a way that is not biased. And speaking of bias, you want to make sure that your clinical documentation does not include any assumptions, any preconceived ideas, or any biases. And it's sometimes, especially when you're working with a particularly complicated case, it's a good idea before you close out the note to go back in and take a look at it and just make sure that nothing crept in there. And finally, a good resource to try to check out is the clinician's thesaurus. There's an electronic version which is featured here in this picture. You can go to Amazon.com and see where you can get a paper copy of the book. If you flip through this book, you'll find all kinds of words and verbiage and adjectives and things that you can use that are commonly used by other counselors in writing up case notes and writing treatment plans and so forth. It really is it's a really great book. I do recommend that you get it just to have. You will get the hang of it and write case notes and it'll come very naturally, but I think this is really good to start off with. I'll read you an excerpt real quick before the recording ends. Child played unwillingly in the waiting room and did not put away toys used. The child exhibited a high degree of play with playthings that were appropriate for the age of a 3-year-old. Parents used control in the